Every child with cerebral palsy is different and requires a different kind of care. Let's hear one mom's story about how she got the right care at the right time for her little boy with cerebral palsy.
It was a perfectly normal pregnancy. Everything was going along wonderful. I actually told one of the OBs that I met with that it was very uneventful. When was something exciting going to happen? And he said, we don't want any excitement. We want it to be real plain and simple. You know, we want the heart rate to stay steady and your growth to stay steady. And I had back pain, and I called the doctor after about 3 hours of it persisting and said, I don't know what Braxton Hicks are. I don't know if this is normal, but my lower back really hurts. It's stiff and uncomfortable. And my sister came over and kind of sat with me and was a little bit disturbed. And so she ended up taking me in and saying, you know, something doesn't feel right. I want them to check you. And they ended up triaging me right away. So at that point, I knew something was wrong, and the pain wasn't horrible, but my uterus was in full contraction. It wasn't relaxing at all. So they told me that they were going to have to take the baby right away by cesarean. When I woke up in recovery, I asked my sister if the baby was dead. And I just remember her saying, no, but it doesn't look good. And I asked her if it was a boy or a girl, and she said a boy. And I said, what happened? You know, is he okay? And she said that she didn't know that we had to get a doctor in to talk to us. So one of the neonatologists came in that was on call, and they told me that my placenta had abrupted and that the baby wasn't receiving any nutrients or oxygen or blood supply. So that's why they had to take him, and that he wasn't able to breathe on his own, and he was on a ventilator. And I say he was hooked up to every wire possibly known to man. So I asked to see him before they took me back to my room. So they took me into the ICU where the babies were. And I remember they had to open these big glass doors and get my big long stretcher bed in there, this tiny little room, to see my son. And I remember seeing him, and he was so small. He was only 5 pounds 6 ounces. And he was hooked up to everything, and the nurses and the doctors were wonderful and let me get as close to him as I could, and I was able to touch him. And then I just remember laying back down and I was out again. One of the nurses actually helped me put all the spaghetti wires together and taped it so that I could hold him. And I was able to hold him when he was about 1.5 days old, which was priceless because I didn't think he was going to make it. And I think he was 4 days old, and he actually started to breathe on his own. They were all wonderful in the ICU.
The Oakwood NICU has been in existence for almost 28 years. Over that time, it has grown both in size and complexity. The type of patients that we now currently manage would include complex surgical cases, cardiology cases, major infections, wounds, etc. The majority of our babies do go home. We have an 85% intact survivor rate here, which is considered excellent. The kids who are not as fortunate, that 15% that are exceptional, many of them are managed by their general pediatricians, but a select few will require the additional services, someone who can coordinate all the care that they're going to need.
I remember Dr. Bear very well. He was very compassionate and very kind. He explained a lot to us about how Luke would probably have cerebral palsy, which we had no idea what that meant at the time. It's a term that you hear and you know it has something to do with being handicapped, but you don't know what it means. So he told me that he would recommend Dr. Susan Young's, that she was a specialty doctor that worked with kids with cerebral palsy, and that he had heard wonderful things about her. So I met her about a month after Luke was out and home. And that's when I realized that Tammy works here, and we had met her, and she was helping us teach him how to drink from a bottle. And we had also met Barb Kay, who was his physical therapist. I didn't know what that meant at the time either, but she came when he was 10 days old in the ICU. And she worked with him and taught me how to range his legs and his arms and stretch him to help eliminate some of the tight muscles that he was having from the spasms.
Our mission at the Center for Exceptional Families is to join families on the journey of caring for a child with special needs, to provide excellent, innovative, comprehensive medical and rehabilitation care, but in a way that loves families and, more importantly, empowers families to grow their children up into young adults who then can choose their own dreams for their lives.
We don't have to shelter him like a lot of parents feel the need to do, because we've been supported through the center and been taught that that's okay, and that these people in the world like our son have value, and they teach us so many things that you can't learn from a textbook. When you look at him and how he struggles to breathe, how he struggles to hold his own head up, and you still see him smile through all that, it's amazing. You forget the little things that are bothering you for the day. And I want to teach everybody that, and I think that the center has made me a better parent and a better person by teaching me that.
I want to thank Dr. Derek Baer, Dr. Eileen Donovan, Dr. Susan Youngs, and the amazing team at the Oakwood Neonatal Intensive Care Unit and the Center for Exceptional Families for the content of our program today. If you'd like more information about Oakwood, about children with special needs, about the Neonatal Intensive Care Unit, please visit oakwood.org or give us a call at 1-800-543-WELL. Thank you very much for tuning in today to Oakwood's Champions of Care.